Welcome to another Healthy Hour. Today's Healthy Hour is with Jonalyn, nurse practitioner at Student Health Services, Valli Cohen, nurse practitioner at Student Health Services, and Elizabeth Veliz, ultrasound and X-ray technologist at the Disney Foundation Cancer Center through St. Joseph's. Thank you all so much for joining me here today. It's such an important topic, breast cancer. It's Breast Cancer Awareness Month, and we really want our students to learn about what is necessary to prevent breast cancer, to take care of themselves. So I really appreciate you being with me today to educate our students. So let's get started right into this because we've got a lot of topic to cover. Let's, of course, whenever I start a Healthy Hour, I always go over everybody's background because I know that there are so many students who are interested in different careers. So let's start with Jonalyn. Tell us about your background and journey to becoming a nurse practitioner.
Okay, well, thanks, Veer, for having all of us on. We're so excited to be here. But I grew up surrounded by family members who were all in healthcare. Everyone was either a nurse or a physician. So I was pretty much destined to work in healthcare. So in high school, I chose nursing as my career. So I went to Loma Linda University and I received my Bachelor of Science in Nursing there. And then I did work a few years in the hospital at USC University Hospital. And during that time, I was like, I really knew I wanted to go back to school to further my education and become a nurse practitioner. So I went back to school. I went to UCLA for the MSN, the Masters of Science in Nursing program, specializing as a family nurse practitioner. So it was a total of 6 years of school. Full-time, it was 4 years for my BSN and then 2 years for the MSN FNP program. Since then, I've worked primarily in women's health and college health, and I just love it. It's been really wonderful and rewarding.
Thanks, Jonalyn. Valli, would you like to share with us?
Yes, hi, and thanks again. I've always wanted to be a nurse. I went to the University of San Francisco for my BSN, and after that I moved to Boston, where I worked for a short time at Boston City Hospital and then as a public health nurse. And the NP role, the nurse practitioner role, was really in its infancy when I decided to attend the University of Rochester in New York, and I obtained my MSN as a nurse practitioner there. Then I returned back to LA and began working at UCLA Student Health. That was my first job as a nurse practitioner. And that was followed by other positions in other places and, ending up at El Camino Community College. Then I moved to Connecticut and I worked as a women's healthcare practitioner at Wesleyan University, University of Connecticut, and Trinity College, and back to LA where I've been at PCC since 2013.
Wow, you've traveled all over the country in your career. That's really fascinating.
To different parts of my life, yes.
Yeah, that's awesome. We have a special guest outside of PCC today. We have Elizabeth Veliz. So Elizabeth, can you please tell us about what it's like to become a ultrasound and X-ray technologist?
Well, I love everything I've done. And it all started with, I have a different condition. And as a 12-year-old, they send me for special X-rays. And I asked the technologist, how did you make the machine work? And she said, don't worry about it. You'll never understand. So I thought, I said, yes, I will. So I went to school. After high school, I went to Glendale College. I got my AS. I went to PCC. So I am a 1984 alumni. And from there, I got my X-ray school license. And then I went to Chaffee Community College, and I went for another year for ultrasound, so I could be a technologist, a sonographer. So after I finished on a Friday, I started working on a Monday at Southern California Radiology for 20 years. I was a chief tech, and I did X-rays and ultrasounds. Back in 2006, I left, and I went to St. Joseph's. So I've been doing breast ultrasound and mammograms since then. But again, I did that same thing at Southern Cal. So I've been doing it for a little while. And that's how I became an X-ray ultrasound technologist, just from a comment. I'll
Wow.
show you.
Whatever that motivation is, that's awesome. And it's full circle for you. You were a PCC student, and now here you are educating our students as well. So thank you for that. So let's get into, what does a nurse practitioner do? Jonalyn?
Okay, so a nurse practitioner is an advanced practice nurse, meaning that nurse practitioners have an MSN degree. So we have our Master's of Science in Nursing degree. NPs are trained to assess patient needs. We can order and interpret diagnostic and laboratory tests. We're able to diagnose. We're also able to formulate treatment plans with our patients. And then we have our furnishing licenses, meaning that we can prescribe medications. The cool thing is NPs can work in a variety of clinical settings. So like Valli and I, we work in the community, like in a student health center. You can work in the hospital, you can teach, you can do research. So it's so nice. There's so many options. And then you get to work collaboratively with just everywhere in the healthcare system. So it's really great. Lots of options.
That's great. Yeah. It's funny you mentioned you were like surrounded by healthcare workers and stuff. My cousin is currently getting her doctorate as a nurse practitioner. So she's talking about doing her research. And since I'm also getting my doctorate, we're talking about our dissertations and stuff like that. So yeah, she's been all over the world being a nurse practitioner, actually, from Japan to Germany, to being able to do that. So, and she does so many things, and she loves it too. She's, I think, she's in maternity health. But yeah, it's fascinating what nurse practitioners do. And I think it's not something that a lot of people know about. So thank you for bringing us to that awareness. Similarly, Elizabeth, tell us about what a mammogram and ultrasound technologist does.
So mammogram, so what I do is we do x-rays of the breast, and how it's done is the breast is put on a plate and a little paddle goes down and compresses. The reason for that is to see the breast. The radiologist reads it, and the more compression, the better the tissue spreads. So that's why it's some people are a little uncomfortable, but we go really slow. And ultrasound, what it's good for is to see if there's something on the mammogram or the patient's feeling something. It can tell if it's something made out of fluid, like a cyst, or solid tissues, which are many things. So that's what a mammogram and ultrasound do. And we also have MRIs of the breast. I don't do those, but those are very important, and they're done with a magnetic field. So there you go.
Thanks. So this question is specifically to our student health workers. So what does a nurse practitioner do, and how do they help PCC students specifically in student health services? Valli?
As well as performing all of the functions that Jonalyn mentioned, I think what's most important in student health is that we work collaboratively with Dr. Walker and with the other nurses, Carmita and Nancy. And often our work requires referral to other PCC services, such as personal counseling. And sometimes our treatment plans involve referring students to specialists. We also work as consultants. We also are consultants for the nurses when the problems arise that are outside of their scope of practice. And I think, unlike other clinical settings where nurse practitioners work, like Jonalyn mentioned, the main, I think, function and importance of Jonalyn and I is that we're part of a team at the health center. And all of us have the main goal of meeting the healthcare needs of our students.
That's so true. We do actually really work collaboratively to make sure that our students' needs are met. Thanks for mentioning that. So let's get into what we're talking about today, breast cancer and breast cancer awareness. This is such a big topic, and it impacts so many people. But let's start at the beginning. Jonalyn, can you tell us a little bit about what breast cancer is?
Sure. So breast cancer is a type of cancer that starts in the breast. And then it can develop when breast cells begin growing abnormally and just grow out of control. Unfortunately, breast cancer doesn't discriminate. It can affect all genders, all ages, all ethnicities. And really, that's why we're here today. October is Breast Cancer Awareness Month, and we're here with Veer, Valli, Elizabeth, and myself to just start that conversation to help increase awareness to all of our students and our PCC family to just be aware, you know, and just know that it can unfortunately affect anybody and everybody, and just starting the conversation.
That's so true. We're here to bring awareness to something that's so important and impacts so many people. Thank you. So let's get into how do we identify if the warning signs of breast cancer. I'm curious for our students to be able to learn about themselves, their own bodies, but also to help others who might have issues with this. So Valli, please tell us, what are the warning signs of breast cancer?
Okay, there are several warning signs, and these occur both in men and women. First, starting with skin changes. You may notice a swelling, a redness, or other visible differences between one breast and another. That can be a change in an appearance in one or both nipples, or the size and shape of one particular breast. Nipple discharge other than breast milk can be a warning sign. General pain in one area of the breast or any part of the breast, or a lump that's felt inside the breast or under the armpit. These are beginning signs, or maybe not signs, but if a person notices that, they should come to the health center or to their healthcare provider and get it checked out. There's some signs that are more specific to breast cancer, more serious in a way, such as irritated or itchy breasts, change in the color of the breast, the skin of the breast, increase in the breast size or shape over a short period of time, changes in how the breast feels. It may feel hard, an area may feel hard or tender or warm, a peeling or flaking of the skin of the nipple, a breast lump or thickening, redness or pitting of the breast. I always like to say, if you notice any changes that look like the skin of an orange. It's also important to remember that all or some of these can be caused by other conditions like eczema, infection, or unrelated to breast cancer. So that's why it's important not to panic, not to have yourself dead and buried, but to come in and get an opinion so we can do the next thing.
Great. Thanks. I've also heard a little bit about the hereditary. There's a huge connection of hereditariness in breast cancer. Could you tell us a little bit about that?
Yes, breast cancer can be hereditary, but most breast cancer is not caused by heredity. But family history is important, and that usually refers to, first of all, having 2 or more first-degree relatives, such as a mother, sister, or daughter, or second-degree relative, such as an aunt, niece, or grandmother with a history of breast cancer. Also, a history of prostate cancer is important, and that can be also in one or a father or a brother or a second-degree relative. And it's even more important if that prostate cancer occurred at an early age. We're not really sure why prostate cancer can affect development of breast cancer, but some people think that it may be a change in the gene that's also passed on. If you have a family history of ovarian cancer in those same first or second degree relatives, or male family members with a history of breast cancer, such as a father, brother, or uncle. And what type of breast cancer is heredity? Only 5 to 10% of breast cancer is hereditary, which means that that breast cancer results from gene changes or mutations in the gene, and those are passed on from a parent. That's called BRCA1, BRCA1, or BRCA2.
Yeah, those are those are the most common ones that we hear about on the news, but it's really, it's good for you to tell us that not all of them are hereditary. Most aren't hereditary. I think that's a big fear that people have, that if my parent had it, I'm automatically going to have it. So thanks for alleviating those kinds of fears, that it's not always hereditary.
You're welcome.
So now we know about the signs of breast cancer. How do we identify them in ourselves? So Jonalyn, can you tell us a little bit about how to perform a chest exam?
Sure, sure. I actually have a teaching model right here.
Yay.
Okay, so whenever we have students come into the health center, we like to teach them how to do a breast or chest exam. And just kind of piggybacking off of what Valli said, you know, those are the symptoms that you're going to be looking for, kind of those warning signs or symptoms. So I actually have a teaching breast model right here, if you can see that. Okay. So of course, when we perform the breast exam, the patients are lying, you know, on a exam table, but then I'm going to be just showing you right here. But we do instruct our patients to use their finger pads because they are very sensitive. So using your index, middle, and ring finger, using your finger pads because they are very sensitive. And every medical provider or clinician is going to be a little bit different as to how they perform an exam on their patient. But then when you're doing it on yourself, you're going to use your finger pads. And you do want to start, you know, you want to make sure you cover the entire breast, all the breast tissue, but you will start at the edge, okay? And you're using your finger pads. And then you'll just kind of start on one side, you know, of the breast tissue. And then there's going to be 3 levels of pressure. You're going to do a very light pressure, like a superficial pressure, and that's right underneath the skin. And then you're going to go in the circular motion. Then you're going to do a medium or like a mid-depth pressure to find that medium area. And then you're going to go a deeper palpation or a deeper pressure, kind of all the way to the ribs. You know, you'll feel your ribs underneath. So for each section, if you're going to be performing this on yourself, you're going to do a light pressure, kind of in a circular motion, a medium pressure, and then a deeper pressure. So then some people like to do an up and down vertical exam. So, you know, you start at the top and then move down a little bit, do the 3 levels of pressure, move down a little bit, the 3 levels of pressure, and you just go all the way down the breast tissue. Then you'll scoot over a little bit and then you'll work your way up. And you want to just make sure you're covering all the breast tissue, all the way from one side, even under the nipple. And then you're going to move your way all the way to the other edge of your breast or chest area. So some individuals do like to do the vertical up and down. And then some people will go in a circular motion from the outer edge all the way to the inner edge. You also want to make sure that you're checking above and below your collarbone because we have lymph nodes in that area. And then some of the students laugh at this part, but we do check in the underarm area, in the armpits, like in the underarm area, because there are lymph nodes there as well. So that's just a really brief overview on how to do a breast chest exam. And once it's safe to be back on campus, we can't wait to see our students. And if they have questions or they want us to teach them how to do a breast chest exam, that's what we're there for.
Thanks. I was following along as you were doing that. I'm like, Jonalyn, how often should we do our own self chest exam?
That's a great question. Before, providers were really saying like, okay, self breast exams, self breast exams, self breast exams, you know, you have to do them every month, you know, and patients would actually go home with this like little card that you can hang in the shower or have in your bathroom, and it would have little punch outs for like January, February, March, April. So we've kind of come away with that and transitioned to more of a breast self-awareness. And that's really like knowing yourself, knowing your risk, knowing your body, like what's normal and what's not normal for your breast chest area. But, you know, if you're like, I really want to check, you know, on a consistent basis, you can just, some people pick like their birthday day every month. So let's say your birthday is on January 4th. So every month, like February 4th, March 4th, you know, that's when you would do your breast exam. breast chest exam. For those who have a uterus and cervix, you can use and still have a menstrual cycle. You can do your breast chest exam a week or two after your period, because that's when breasts and chests are less sensitive. Or just kind of picking a consistent day for yourself, like every month.
Okay, thanks. So I'll remember that and put that on my calendar, like a little alert on my phone.
Yes.
Thanks. That was really, that was so informative that I'm like trying to figure it out myself. So if I do find something that concerns me, or if I do think that there is a sign of cancer, Elizabeth, what are my next steps? What are some resources that I have?
So first thing you'll do, go to the health center or your provider, as mentioned before. They're going to go ahead and order exams, most likely. You know, a mammogram, ultrasound, MRI, whatever it is. There are resources, for example, if something is positive, like most mammography centers, they have someone called a nurse navigator, and she guides the patient where to go. They'll see their provider will tell them which oncologist, surgeon to see. All of that is taken care of. If someone does not have insurance, the resources, there's many out there, but I'll give an example of one of them, which is the Harold Pump Foundation. And it's also available in Spanish, and they have free health fairs every second Friday of the month. Services for women include free mammograms, free breast self-exam instructions, cancer education, and tips to help you stay healthy. Requirements must be uninsured and be 40 years and above. So there's different things that are available. And again, a lot of the nurse navigators provide the patients with all the those informations. So, and you can also call the American Cancer Society, because they also have a lot of resources for us folks, for anyone needing it. Mm-hmm.
Okay, great, thanks. If we were being referred to get this test, what could we expect in this kind of in a kind of mammogram test? I know you kind of explained it.
So in a mammogram test, they'll have the patient's breast is put on a device. It's going to be compressed. It's to spread out tissue so that the radiologist can read it. The tighter the better. So most technologists like to go slow to allow the patient to take as much as they can. We have our tissues composed of many things. We have fat, we have tissue, we have vascular ligaments. There's a lot of things that the breast has. So we want to look through everything we can, or the radiologist does. So when the tissue is compressed, and if, say, a patient has dense tissue, it spreads it out a little bit better. Dense tissue means more breast tissue than fat. And on a mammogram, it looks white. So cancers look white. So the radiologist is looking for like a ping pong in snow. It can be done, but that's why the mammogram comes in. There's two kinds of mammograms right now. There's the 2D and the 3D. The 3D at our place includes a 2D, and the 3D cuts in millimeter cuts, so the doctor can see it spread out even better. It captures about 40% more findings. It doesn't mean it's going to be bad, but it captures things. So from there, most patients, if they see anything, they'll have an ultrasound. And the ultrasound's pretty easy, because you lay down, you put your arm up, warm gel's put on, and then the sonographers get to look and see what it is. And we look at the mammograms to make sure we're matching both together, the areas. So that would be the next step. Something positive, as I mentioned, the referring doctor refers them to surgeons, oncologists, etc. most patients will have an MRI, because what an MRI does is when you have contrast, um, which is something they put via the vein, it enhances the breast tissue. Cancers, when they have a lot of vascularity. So with this contrast, it just goes pop, it pops up. So if there's any other areas that are seen on the MRI, then sometimes the patients go back to another ultrasound, or they have an MRI guided biopsy. With the mammograms, we can do biopsies, and with the ultrasounds, we can do biopsies. So they try to capture, if positive findings are found, everything before surgery, because they want to do the surgery once and take care of anything that's there.
See. Oh, interesting. So Elizabeth, you mentioned 40 years old. So it just popped into my head. They do mention, Cancer Society does mention, when should we start getting checked on a regular basis? At what age?
40 years old, unless something comes up before that. So if nothing comes up before that, 40 years. We have different entities like the American Cancer Society, and they say like every 2 years after the age of 50. At our place, we in imaging radiology, we have something called American College of Radiology, and we recommend every year because we believe in early detection. So we don't, we're a little bit different than American Cancer Society, just because we want it more often. So that's a little difference there.
Okay. So it's kind of check every month or so, pick a day to self-check. And then after a certain age, if everything's okay, start getting checked more often with using a mammogram. Is that correct? Is that what I'm hearing?
Correct. Mm-hmm. Yes.
Great. Thank you all so much. That was so informative. And I'm going to go and check myself now too afterwards, because I want to make sure, know my own body, know what to do, make sure that my chest is okay. So thank you all for joining us. Thank you for taking your time out of today to do it. I appreciate you all being with me today. That's it for Healthy Hour. Thank you for watching today. Again, thank you, Valli, Jonalyn, Elizabeth, for joining us. And I will see you all next time. Bye.
Thank you.
Bye.
Bye-bye.